Most of your immune system is in your gut.
Yeah.
So when you disrupt that ecosystem, that rainforest inside of you, you are disrupting the immune system.
Welcome to the Doctor's Pharmacy. I'm Dr. Mark Hyman, and that's Pharmacy with an F, F-A-R-M-A-C-Y, a place for conversations that matter. And if you've struggled with any chronic illness, this is the conversation you need to listen to because it's with one of the leading experts in the world on how to deal with chronic disease, which is my colleague here at the UltraWellness Center, Dr. Todd Lapine. Now, Todd and I go way back. In fact, Todd knew about functional medicine before I even heard about it. Way back at Canyon Ranch in the 1990s. That's right, 1990s. We are old, but we look young. And he was way ahead of the curve, and he still is. He's still really one of the most brilliant minds in functional medicine. He teaches everywhere. He's certified by the Institute for Functional Medicine in functional medicine, obviously. He worked with me at Canyon Ranch for 10 years, and now he's worked here for a decade at the UltraWellness Center. And collectively, we have literally probably 5 decades worth of experience in functional medicine between the two of us, seeing so many thousands of patients who struggled for so long with so many issues. When they finally get here, they find there's a new way of thinking about disease, and it gives them an opportunity to actually get healthy again. And we're just so grateful to be able to have you here at the UltraWellness Center and able to do the work we do. You really help work on some of the most leading edge concepts in medicine around biodetoxification, systemic inflammation, GI health, and neurobiology of mood and cognitive disorders. He's given lectures all around the world at age management conferences, at American College for the Advancement of Medicine. He's taught at the University of Miami Integrative Medicine Conference at Crapalo. And he's on the Scientific Advisory Board of Designs for Health and consults with Diagnostic Solutions Lab. And he's very active. He skis, he kayaks, he hikes, he camps, he golfs. He loves the Berkshires. He's just been an extraordinary addition to our center. So welcome, Dr. Todd Lapine.
Thank you, Mark. Thank you, Mark. That was really nice.
Okay, so you started off your career working as a resident at a VA hospital.
Yes.
And
best learning experience ever.
Yeah, pretty much. You see everything. And you get to do everything.
Exactly.
And,
you've been there, you know.
And I have. Well, I have. And you had this patient who has quite a problem that gives a lot of insight into functional medicine, which is called hepatic encephalopathy, which in English means that when your liver fails, you can't detoxify, and all your normal metabolic toxins makes you delirious and can even put you in a coma and gives you all these brain symptoms. So what happened when you treated him with the typical treatment? And tell us what that is, because it's kind of an unusual treatment for a brain problem.
Right, exactly. So the story is I was a resident and I was, wet behind the ears, and I had a patient at the VA, and a lot of patients at the VA, some of them had alcohol and tobacco abuse, and he had liver failure. And he came in a coma with hepatic encephalopathy.
And by the way, just an aside there, it used to be the most common source of liver failure was alcohol.
Yeah.
Now it's sugar.
Yeah, right.
Which is a big reason for liver transplants.
Right.
Anyway, keep going. Sorry, I had to interrupt you on that one.
Yeah. So he comes in completely in a coma. I mean, you could stick a pin in him, he wouldn't move. And so we worked him up, and I had to sort of learn about hepatic encephalopathy because I didn't really know what it was. And so we treated him, and I found out that it was related to his liver not being able to detoxify, and he had also had a high protein meal intake, and the protein gets digested by the gut bacteria, and all the blood from the liver all the blood from the gut has to get filtered through the liver before it goes into the systemic circulation. So what we did with him is we basically treated him with nothing by mouth. We gave him antibiotics. I believe it was neomycin.
I mean, you stop feeding the bad bacteria. We producing the toxins.
Yeah, we cleaned out the food for the bad bacteria in the gut. We sort of gave his gut a rest. Gave him antibiotics and neomycin intravenously. Also gave him laxatives, specifically lactulose at the time. I don't know if you've
lactulose and neomycin orally though. Don't you give the neomycin orally?
I'm trying. It might have been orally. It might have been orally. It might have been orally. You're right. It could very well have been orally. So we gave him lactulose, and then we also actually, believe it or not, gave him probiotics. And within 24 hours, this guy who was in a complete coma completely woke up, just like the proverbial Lazarus, and it was amazing to me. So I've been looking at it, and I'm saying
that'll wake you up.
Exactly. That'll wake you up. And I said, this guy woke up from the dead. And I was like, it actually left an indelible impression on my experience as a physician, saying there is a huge connection between the gut and the brain. And then that has led me on the quest that I've gone on for all these years, and seeing the connection, how our internal ecosystem, the microbiome, and the food that we eat and the food that we feed the bugs affects our health in good ways or bad ways.
Yeah, it's so true. And I remember learning about the disease, and I was like, how come doctors don't connect the dots with the gut and everything else that goes wrong in the body?
Right.
Because the treatment for this coma that's caused by liver failure is essentially giving antibiotics that aren't absorbed. So you kill all the bugs in the gut that are producing these toxins that make them crazy or make them in a coma.
Mm-hmm.
So, and then you give them a lot of laxatives to make them poop everything out.
Yep.
And that's just kind of a miracle happens, right?
Yeah, it was a miracle.
Wake
exactly.
up from the dead.
Exactly. Wake up from the dead. Exactly.
And that led you to kind of understand the interconnectedness of everything.
Right. And then, when we see patients all the time, a lot of patients come into us and say, "Doc, I've got brain fog." That is low grade,
Yeah, you're not in a coma, but it's the same
yeah,
thing.
Yeah, you're a zombie.
Right.
I call it a zombie. You're living dead. You're walking around, but you're not really there. Your brain is being affected by some of these chemicals, and there's a lot of different chemicals that are produced by gut bacteria. Some of them are putrescine and cadaverine. You know what cadaverine is. You don't want a whole lot of cadaverine unless you're a cadaver.
That's right.
Right.
Those sound like terrible things. Putrescine and cadaverine. Those are the toxins that get released from bad digestion, right?
Yeah, and even one of the compounds that we measure now in the office here is TMAO, trimethylamine oxide. It's the same type of bacterial byproduct of metabolism of certain food products. So certain bacteria will eat certain foods and produce these compounds which have psychoactive properties or inflammatory properties, because TMAO is one of the risk factors for heart disease.
So one of the central ideas of functional medicine is you start with the gut.
Yeah.
It's almost what you start with anybody who's got anything, which is kind of a weird thing because like, how can you treat everything with one thing? But it actually is a foundation of our health. And when our microbiome is out of balance, it leads to a whole host of problems, right?
Absolutely, yeah. And the big thing that I don't treat children with autism, but the biggest thing that I think that is affecting this country is the microbiome that we're not inheriting from our mothers.
Yeah.
Because what happens so often now is that when mothers go into the hospital, they're getting antibiotics beforehand. Half of them, 40%, 50% are getting C-sections. So we are destroying our...
And then we don't breastfeed.
Don't breastfeed, exactly.
And then we give kids antibiotics.
They give antibiotics and vaccinations on day one, for hepatitis B. And this microbiome that we have literally inherited from generation to generation, because it's something that's really passed down from the mothers to the daughters to the granddaughters, is being lost. And the loss specifically of Bifidobacterium infantis. It's actually been I think it was in the New York Times that it was talking about this loss of this one of many beneficial bacteria that we are losing as part of the human species. And it's affecting our whole health.
So let's back up a little bit and talk about this whole thing of the microbiome. Because we started with functional medicine. There wasn't the word microbiome, but we still focused on normalizing the gut function. We talked about the 4R program, which is a restoration program for the gut and how that can help so many different diseases. But what is the microbiome? Why is it important? What does it do? I mean, we thought it was just poop, and now it's like basically the holy grail for figuring everything out.
Yeah, so it's gold. It's gold, and actually, in
brown
fact,
gold
is brown gold, right? so down in Boston, so the microbiome is the sum total of all the organisms that we have and carry around inside of us, and that also can include viruses. It can also include fungi, and it's not necessarily, we call it good and bad, but it depends really upon the situation. Because, like for example, all of us carry around C. difficile bacteria. C. difficile bacteria, when you take an antibiotic, it'll wipe out some of the good bacteria, and then the bad guys, if you will, they'll sort of start to overgrow, and then they can produce toxins. So
that happened to me, and I almost died from it.
Exactly. Exactly. And the treatment of choice for that is, if you have a really bad case, the treatment of choice is a stool transplant, which is like an organ transplant. And the interesting thing is that one of the companies that does this is Open Biome in Boston, which I think you're aware of, and they use freeze-dried stool. And that is one of the cures, literally, for a really messed up gut microbiome. Because
you can even get poop pills now.
Poop pills, yeah, crapsules. 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 Right. Crapsules.
I've never heard that. That's a good one. How many crapsules do you take?
Right. And what it is, and I always make analogies because that's how patients understand things. It's sort of like, the ecosystem of the microbiome inside the body is like a rainforest. And at some point, some people's ecosystems are so disturbed and so messed up that it's like napalm has hit your rainforest.
It's like a corn monocrop.
Yeah. And so what you need to do is you need to repopulate the microbiome.
These are
Yeah,
good.
right. Yeah, we're going to get a little puns here. Yeah, you need to repopulate the microbiome. And you can't do that just with probiotics, although we use probiotics and we use prebiotics and we use those together. We call them symbiotics. And those are oftentimes very helpful. But for the really sick people who have things like refractory C. diff, stool transplant is the #1 treatment.
Yeah. Interesting. So you've got this whole ecosystem bacteria. It's been disturbed by all these reasons you talked about: C-sections, antibiotic use, lack of breastfeeding, and so on. And our diet also plays a huge role in the growth of good or bad bacteria. So you can feed it certain things and it makes it worse, and other things and it makes it better. So talk about that.
Yeah, so I always tell patients that when you're eating food, you want to be choosing your food, not just for you, what you like, your the things that are pleasurable for you, but you also want to be feeding the good bacteria. And we talked earlier about this Akkermansia muciniphila. That's a specific bacteria that is in the body and that you want to have on high levels. And when we do the testing, we can actually determine, do you have high levels of it, or do you have low levels, or do you have no levels, or very low levels? And there are certain foods which you can incorporate into your diet, things like pomegranate and maca and acacia fiber, cranberries and things like that. These are foods which are basically prebiotics. And when you incorporate them into your diet, it's like putting Miracle-Gro on that garden. They start to flourish, they start to take over, and they help balance out the whole ecosystem.
Yeah, I think it's one of the biggest advances in our thinking about gut. We just give probiotics and that'll fix it. But you're giving like 50 billion is a lot, right? But you have 100 trillion bacteria. Yeah. So it's like a drop in the ocean.
Exactly.
And one of the big insights I had was actually from an experience I had last year where I developed colitis. It's a long story, but I had been sick from mold, and I've told that story, and I had a recurrence of my gut because I had the C. diff, and that was kind of really messed me up. And I checked my stool and I had really low levels of this Akkermansia, which has been linked to autoimmune disease, been linked to poor response to immunotherapy for cancer. It's been linked to cardiometabolic disease and diabetes. And I'm like, whoa, this is not good. So I started to research it and created this cocktail of cranberry, pomegranate, green tea, acacia fiber, some probiotics, other prebiotics. And I took it, and it literally within 3 weeks, I went from full-blown colitis to completely normal, perfect.
Yeah.
And it was sort of a wake-up call for me, which was, you can't just give probiotics. You've got to feed the whole inner garden. And what it likes is certain foods, and it likes all the polyphenols.
Yes,
and the
polyphenols.
Colorful, dark, rainbow-colored chemicals that are in plant foods.
Yeah.
There are certain plant foods have more of them, like the berries and so forth.
Absolutely. Yeah, the polyphenols are gold. And to me, I think that's actually probably one of the things that plays a role with the French paradox is the polyphenols that are found in red wine.
Yeah.
I think that's, definitely what you're doing is you're actually feeding the, patients love me because the two things that I always prescribe to my patients is chocolate and red wine.
Depends.
Right? And they're high.
I would say people like wine drinking, but I wouldn't give it as an extra thing.
No, right. But I'm just razzing. But the polyphenols are the miracle food prebiotics for the gut. Absolutely.
So tell us a story about a patient who had a screwed up microbiome and what you did and how they got better.
Oh, I've had, multiple patients. For example, I just had a patient I followed up today, 18-year-old with fatty liver disease and sort of pre-diabetes picture. And lo and behold, I did the testing for him, and his Akkermansia muciniphila was almost undetectable.
Yeah.
And now, fatty liver, typically, like you said, we used to see that in patients who were drinking alcohol. What we're now finding out is that fatty liver is the thing that is being driven by disruption of the gut microbiome. So what's happening is when you destroy the mucus, the protective mucus lining of the gut, some of those bad bacteria get into the body, get into the circulation. They go into the liver and causes systemic inflammation, which in turn causes fatty liver. And there was just, I don't know if you saw the recent paper about this, about what is termed non-alcoholic fatty liver is actually from alcohol produced by gut bacteria.
Yeah.
So some bacteria will actually produce alcohol, which in turn poisons the
It
liver.
ferments, right?
It ferments.
Ferments.
Exactly.
Just like, when you get this bloating food baby, that's actually your bacteria fermenting the food you're eating, and certain foods are more fermentable, like starches and sugars.
Exactly.
Yeah, we actually have seen cases of patients who literally had elevated blood alcohol levels.
Yeah, autobrewery syndrome.
From the bacteria in their gut.
Yeah.
And they literally got pulled over and found, they had, like, for drunk driving.
Exactly. And it actually, the autobrewery syndrome is, I've had a couple of patients with that, and they typically that's usually been attributed to yeast overgrowth. But there also are cases specifically with bacteria that can also produce alcohol. I mean, you're basically, it's a brewery in your gut, in your body.
Yeah, you don't need a Budweiser.
No. this Bud's for you.
So what happened when you have this patient and you
Yeah, so I mean, you basically you work on doing dietary interventions.
Did you get better when you fixed this, or you just saw
this was just I was just offhand because I just had this patient this morning, and it was a very interesting case because the thing that really stood out is that his protective anchor-man's eosinophilia was quite low. He was also a vegan. Which we could discuss. What is the best diet? I don't believe that veganism is actually the best thing. I think we're omnivores, and I come from a family of dentists, so I always talk to my patients. See that thing right there? That's a canine tooth, and a canine tooth is designed to chew meat and to chew fish. And we have specific enzymes in the body, which are pancreatic elastase and proteases, which are designed to digest protein.
Yeah.
So we are, like Michael Pollan said it best. Eat plants, eat food, real food, mostly plants, not too much.
Right.
So a plant-based diet with healthy amounts of fish and lean meat on occasion is really probably the best type of diet.
Yeah.
And I think some of my most difficult patients are the ones who are sort of strict vegans for whatever reason, ethical or spiritual or whatever, religious, can oftentimes get into really difficult situations because it's like a cat chasing their tail. They don't have the specific nutrients to patch up and heal the body.
But doesn't all that plant stuff help the microbiome?
It does, absolutely. It's going to help the microbiome, but he had almost no omega-3s.
It was really nutritionally deficient.
Right.
You see, unless people are supplementing, they get super nutritional.
Well, exactly. You can have a person like it was just in the news recently. It was a 22-year-old, I think it was over in England, who was living on potato chips, white bread, and French fries, and went blind.
And French fries,
went blind.
There's no vitamin A.
Yeah, went blind.
Yeah.
So you can be walking and talking, but you can be severely malnourished.
Yeah.
Because there's about 40 nutrients that your body needs on a regular basis. And I like to also make the analogy to my patients is like your body is like a house that's being built and broken down 24/7. You need all those building materials to make that house. You need carpeting, you need wood, you need glass, you need all these materials. And if those materials aren't there, then the structure may still be standing. But if you don't have glass, the wind comes in, the rain comes in, the snow comes in, and then you're going to have problems with your body.
The problem with traditional medicine is they don't look for those building blocks. They don't test for them. And that's what's different here at the UltraWellness Center. We actually look for these things. We find them. I mean, when was the last time a doctor looked for akkermansia in someone with fatty liver? Probably never, right? Other than us here or some functional medicine.
Or check their omega-3s or check their vitamin D. Yeah, exactly. Yeah, they're right.
And so those kinds of diagnostics are available and help us really think differently about treating disease. I mean, most doctors understand hepatic encephalopathy, but most doctors who are treating fatty liver don't actually think about what's going on in the gut microbiome or how to treat it. They don't even know how to fix it.
Well, the thing that one of my pet peeves, Mark, and I'm sure you've heard this too, is that patients will go see the expert endocrinologist for their diabetes and the expert gastroenterologist, and they tell the patients to eat anything they want. That is absolutely...
Wait, you mean food has something to do with our health?
No, it does? Oh my God.
What a radical idea. No, my favorite was once I was at Canyon Ranch. I was playing basketball at lunch because they had these basketball pickup games, and there was one of these people there who was playing, and he was a gastroenterologist. And I said to him, have you ever thought of like how, food might impact what's happening in the gut? Because you're putting literally pounds of this stuff through that tube every day. You think it might have something to do with why people have digestive symptoms? He was like, gee, I never thought of that. That seems so interesting. Yeah, that makes a lot of sense. And I'm like, Holy crap.
Yeah, right.
You know, but yeah, I mean, your microbiome is dependent on what you feed it. How you grow your inner garden depends on what you're eating.
Yeah,
And you
exactly.
can create a nasty garden with weeds and toxins and bad stuff and poisonous plants, or you can create a really flourishing, rich garden that actually takes care of you.
Yeah, absolutely. And then also the other aspect thing that a lot of even physicians are not even aware of is that most of your immune system is in your gut.
Yeah.
So when you disrupt that ecosystem, that rainforest inside of you, you are disrupting the immune system. And we're talking about fecal transplants. There's a recent study that showed that children with autism who got stool transplants had a marked improvement up to 2 years out from just replacing the gut microbiome.
Yep.
I mean, that's pretty powerful. So there is no pharmacologic.
Because autism is like an encephalopathy. It's a metabolic encephalopathy.
To some degree,
it's
absolutely.
like a hepatic encephalopathy.
Yeah, I mean that's to me that's sort of the canary in the coal mine in our environment today. You know that we have what 1 in 68 kids having autism now, depending on where you are living in America and around the world. That is a big issue, and what we're finding out is there's more and more connection to the microbiome.
Yeah, I mean, so 60% of our immune system is in the gut.
Yeah.
And essentially, there's a sewer that's on the other side of the lining of your gut, which is only 1 cell thick. And on the other side is your immune system. And if there's a breakdown, which can come from having C-sections, antibiotics, acid-blocking drugs, stress, poor diet,
Yep.
all that stuff damages the gut, creates this leaky gut, gluten, dairy, all those things. Then you get this inflammation. So we treat a lot of people with autoimmune disease here at the UltraWellness Center, and often the place we start is the gut.
Yeah.
So tell us like how that works and about some patients you might have had with autoimmune disease and how working on their gut helped them.
Yeah, so I mean, I had one patient in particular who I saw who came in. It was a great story. She came in and she was having MS as her diagnosis. She also had autoimmune disease, multiple sclerosis, and she also had infertility. And I did a complete workup on her. She had dysbiosis, had bacterial and yeast overgrowth, also had sensitivity to gluten, and had also some, not a big level, but some level of mercury in the body. So I worked on diet, worked on both prebiotics and probiotics to clean up the gut, got her completely off of gluten. And lo and behold, guess what? Her multiple sclerosis went away.
Amazing.
Disappeared. All right, not to say that.
And you got her metals out too.
Yeah, not to say that all cases of multiple sclerosis are due to that, but there are many pathways to multiple sclerosis, just that there are many pathways to Alzheimer's disease.
Or any disease.
Or any disease, exactly, because the body will manifest it in only certain inflammatory pathways. So ultimately, she got off of her medications. Her MS to this day is in complete remission. She has no symptoms, on no meds, and as a side effect, she got pregnant.
Wow, that's a good side effect.
Yeah, and she was happy.
So that's an amazing story. And I think, for people who are listening, functional medicine is a new way of thinking about disease. It's not based on the label, MS. It's based on the cause. And you can have one disease that has many causes, like MS, which can be caused by heavy metals, by Lyme disease, by Epstein-Barr, by the gut microbiome, by gluten, like B12 deficiency, right? You can have so many things that are driving this same syndrome.
Right.
And the personalization of medicine is what functional medicine is all about. And that's really what's different here about how we practice medicine at the UltraWellness Center, because we're looking at each person as an individual. We're creating personalized medicine and personalized health, which is a radically new way of thinking. And we just lump everybody with the same symptoms into the same categories, but it doesn't tell you anything about the cause. And I always say, just because you know the name of your disease doesn't mean you know what's wrong with you, right?
Absolutely.
And that's what we do through very detailed histories here, through very advanced diagnostic testing to look at some of these things.
Oh, absolutely. And I think the enjoyable thing, and that I'm sure that you experience yourself, is that every patient is unique.
Yeah.
I've never treated 2 patients the same way from a functional approach.
No.
Completely different. Even in the same family,
True.
Everyone is, and that's actually the fun part about it. Is I call it, the person comes in with their own genetic uniqueness, their own, personality makeup, their own story, all of these, things that you can paint the picture of, where were they when they got sick, where are they now, and what are the things that that we can remove, like the 4 hour. What do we
Sort of
need
like
to
being
replace?
Dr. House, right? It's like
Yeah, it's
medical detectives.
Yeah, like medical detective, exactly. And I think one of the most important things that I always tell people who are training in medicine is to listen to the patient.
Yeah. They'll tell you what's wrong.
Absolutely.
And when and what.
Exactly. And sometimes I just have to sort of bite my mouth, because you want to always interrupt patients and say, well, what about this and what about that? I just sort of let patients talk more, and I just sort of listen, and then I'll ask the questions later. And when you really do that and let the patients tell their story in their own way, in their own terms, and get that out, you really find out all the little details, and you can play house and play detective, try to piece the pieces of the puzzle together.
Yeah, we in regular medicine, we are trained to create an exclusive history. In other words, someone comes in with a symptom, let's say they have heartburn or reflux or chest pain. We don't want to know anything else about them except about that.
Yeah.
Right? We want all the details about that. We don't know if they have a rash, are their fingernails cracked, do they have eczema, does their butt itch? Like, don't talk to me about any of that, because that's not relevant. And in functional medicine, all of it's relevant, because it's a clue that could give you a clue to what's actually happening for that patient. And that's what's so beautiful about this process. I think I used to work in the emergency room. I think you did too. It's boring. Yeah. It's boring because someone comes in and he's like, okay, it's the heart attack treatment. It's the asthma treatment. It's the kidney stone treatment. It's a protocol. It's like you just look at the nurse, you go, oh, heart attack. Okay. And they know what the orders are. They know what to do. You just barely write it down. And it's like rote and boring. It's a formula, like a recipe.
Right.
In functional medicine, there is no recipe. Yeah. There's actually having to think every time you see a patient.
Right. And being trained in traditional medicine and also in a functional medicine approach, there's definitely, if you're having a heart attack, I want a thrombolytic. Absolutely.
You blew out your knee. You needed knee surgery.
Right. I want you to follow the protocol that has been shown to work. But for chronic conditions, acute care medicine, which is basically the scalpel or the prescription pad, are probably some of the more toxic things that you can have. A lot of what I see in my patients here is iatrogenica imperfecta. All right, which basically
translate that, doctor.
Translate that, which basically means the doctor did it, right? So the patient comes in and they're on a whole laundry list of medications, and these are interacting. They're on proton pump inhibitors. They're causing calcium. The acid blockers. They're causing calcium deficiency, mineral deficiency, B12 deficiency. So there's these drugs have their risk benefit, and the less drugs you use in medicine, the better off the patient is.
Yeah, it's hard because that's what we know how to do. It's what we're trained to do. Yeah. It's like we don't know how to treat people with food as medicine. We don't know how to restore a gut from a messed up gut to a healthy gut, and that's really what we do in functional medicine.
Yeah, and the other important thing that it's important for physicians out there who are new to functional medicine, also for patients, is to realize these things don't happen overnight. It can take time, but usually sometimes you can see a difference in days to weeks. Sometimes it could take months, and sometimes it takes years. It depends on what's going on.
So true. I mean, sometimes it's almost miraculous, and you go like, it's hard to believe. I remember when I first started practicing, I would go, okay, do these things, take this, eat this, and then they'd call back a few weeks later, or a month later. I'm like, how you doing? Well, I'm all better. I'm like, what? You're better from that? Because it was such a contradiction to everything I learned. But then I started to trust it, and I started to expect it. And I just remember this one patient. She had psoriatic arthritis, which is a horrible condition where you've got psoriasis, but your joints are being deformed and destroyed. You're in pain all the time. But she had a bunch of other stuff, which, quote, was unrelated. She had depression. She had insomnia. She was overweight. She had terrible reflux and heartburn, and she was having bloating and SIBO and irritable bowel. And I'm like, okay, well, let's see. She's inflamed. Everything that she's got is inflamed. The weight is inflamed. Depression's an inflammation in the brain. Yep. Her gut symptoms are about inflammation in the gut. Everything's related to inflammation. So why don't we sort of just start simple and clear out things that are causing potential inflammation? So we got rid of gluten and dairy in your diet, and sugar and starch and all processed food. We got her gut cleaned up. I gave her an antibiotic and antifungal and a little gut program and a couple of nutrients to help her fight some inflammation that she was suffering from. And 6 weeks later, she came back. Her psoriasis was gone. Her arthritis was gone. Her reflux and irritable bowel was gone. Her depression was gone. She lost 20 pounds. I'm like, and she got off all her medications, even the one that was costing $50,000 a year to suppress her immune system from the psoriasis. Wow. And it seems like a miracle, but it really isn't when you follow this methodology. And That's what we've been doing here for decades, practicing functional medicine up in the Berkshires, in the middle of nowhere. But
Yeah.
it's pretty amazing.
Well, it's really interesting because most of the patients who have psoriasis are going to see dermatologists, and most dermatologists do not have a clue about the gut microbiome, nor are they testing or thinking about it.
Right.
And then if they get psoriasis and they develop psoriatic arthritis, which is arthritis in addition to the skin condition, because I always tell patients is the skin is contiguous with the gut. So if I draw a line on the skin and I keep drawing a line and go down my tongue and I go into my esophagus, down to my stomach, into my intestine, I'm still on the same surface.
Yeah.
So oftentimes, and you know this, Mark, is that
That's true. I never thought of that.
Yeah, it's
kind of a cool thought.
That's how I explain it to patients. So the skin is contiguous with the gut. It's an ectodermal tissue, and when there's skin issues, think gut.
It's really a tube. It's outside your body, is your gut.
Yeah,
it's true. I mean, when I have a patient with psoriasis, eczema, acne, rosacea, I treat their gut.
Yeah.
And I don't put stuff all over their face or on their body.
Exactly.
To suppress the inflammation. I get rid of that. And it's like really a miracle. I mean,
it is.
I mean, dermatology is not something that I'm an expert in, although I was trained as a family doctor in dermatology. But I feel like we get the most amazing results just for something as simple as fixing the gut and changing the diet.
Absolutely. Yeah, exactly. Yeah. I mean, the body's this interconnected, complex, self-healing organism. I mean, that's the big thing is I often ask patients, I mean, do you think you're going to get better? And if I have a patient who thinks they're going to get better, then together we're going to get better. But if I have a patient who doesn't think they're going to get better, then I try to get them to change their mindset. Because even though somebody comes to me, they really almost believe I'm not going to get better.
Well, that's what they've been taught.
Exactly.
You have to live with this. We have to manage your disease.
Right.
And I don't want to manage it. I want to get rid of it.
And the body's ability to self-heal is amazing, as you know, Mark. It's really amazing. There's an intelligence in the body that we, have, as much as we know about the body, there's a lot more that we don't know. And the more I practice medicine, I think the more humble I become because I realize how little I know. It's how complex it is. It's really, really complex. But there's so much that we can do for patients that, they've gone to, the Mayo Clinic, they've gone to Mass General, they've gone to, X, Y, and Z everywhere else. And they, as you say, the resort medicine, we come here for last resort. I mean,
I literally just walked from my office to here after seeing a patient who went to the Mayo Clinic who had chronic dizziness, chronic constipation, fatigue, insomnia, all these different symptoms that they couldn't find, quote, anything wrong with him. And I'm like, well, I know what's wrong with you. You've got this, this, and this, and this based on looking at it through the functional medicine lens.
Yeah. Well, and the other thing is, I think it was Sid Baker, I think, who made the analogy, or maybe it was Jeff Bland, is that, if you have a dime and you're on a dark street and you lose your dime over there and the street light's over here and you're looking under the street light, which is where you're testing. So most of the testing is basically looking where the dime isn't.
Yeah.
All right. So the type of testing that we do here, which is nutritional, metabolic, toxic, genomic testing, is spreading out the searchlight to find that dime.
Absolutely. That's such a key point because you go to the doctor and they say, well, we've tested everything and all your results are normal. And the implication is it's all in your head. But I would say I don't agree with that because, either two things are true. One, the patient's crazy or the doctor's missing something. And I'm going to bet on the doctor's missing something. Yeah. Because when we start to look, we find all sorts of stuff in places that nobody's looked before because they're looking under the street lamp instead of actually where the problem really is.
Exactly.
Yeah.
That's exactly right. Yeah.
And I think, what you alluded to before was really important, which is that functional medicine is about getting rid of the things that impair health and putting in the things that help the body thrive. And then the body can take over and with its amazing intelligence can repair and heal from all sorts of things.
Oh, totally. Yeah.
And that's what we do. So one of the complaints we see a lot is fatigue. Everybody's tired, right? And in functional medicine, we talk a lot about something called the mitochondria, which you're really an expert in. And it's something that is really one of the keys to solving many problems and puzzles in chronic disease, whether it's Parkinson's or Alzheimer's or diabetes or obviously fatigue issues, so forth. Fibromyalgia. Tell us about what are these mitochondria? How do we look at them? And what do we do about it?
Okay, so for those who don't know about mitochondria, it's another area of mine that is really a fascinating sort of interest of mine. So our mitochondria are actually ancient bacteria.
See, poop, bacteria, you're in the same track.
Absolutely, right. So
you have a one-track mind.
right. And I'll never forget, I went to a lecture given by Jeff Bland, and he was talking about how antibiotics, which are designed to kill bacteria, can oftentimes affect mitochondria, because our mitochondria, which are the power plants of our bodies, are actually way back when were ancient bacteria that became engulfed in our cells and are now the power plants of
and
our
they have
cells.
different DNA.
They have totally different DNA. Yeah, in fact, the Lynn Margulis, who was married to Carl Sagan, I had the opportunity to meet her and have lunch with her.
And
Yeah, it was amazing.
for those of you who don't know, she's sort of an icon in the world of biology.
Yes.
Who first described this whole phenomena.
Yes, exactly. So she it was right during the 60s. Everyone was studying the nuclear DNA, which is the double helix DNA. And she made an observation that there's DNA in the cell in a circular form. And she goes, well, what does that mean? Where did that come from? So she was actually a protist. She studied small ancient bacteria, and she realized that DNA reminded her of the ancient bacteria. And then she came up with the hypothesis that eukaryotic cells, which are the cells that we have, actually way back when those little bacteria came and sort of created this symbiotic relationship where you scratch my back, I'll scratch your back.
Yeah.
And that's really, how we have mitochondria. And mitochondria are so important that, and this I always tell patients, is that if you take cyanide, you will die in a matter of minutes. And the reason for that is cyanide flips the switch on your mitochondria.
Turns them off.
Turns them off like that.
Yeah, basically that's what happens when you die. You have no energy anymore.
Lights out.
And your lights are out.
Yeah.
And yet there's varying forms of lights out with mitochondria that are really common, whether it's autism, we're finding now, Alzheimer's, Parkinson's.
Right. And the interesting thing about it is there's a thing called the bottleneck theory of mitochondria, which is that, let's say.
Before you go on, so mitochondria, for those people, they're these little tiny things inside your cells. There can be hundreds to thousands of them. And they basically take oxygen that you breathe and the food that you eat, and they burn them like an engine. And outside and out comes energy, which is what runs your body in the form of ATP. So that's what has to happen every day, every minute, for you to run every chemical reaction in your body, to run everything that you're doing.
Everything.
And when that process gets bunged up, you get sick.
Exactly. That's very well put. Exactly. You get bunged up, especially the highly metabolic tissues. So things like the brain, things like the heart are the highly dense mitochondria. And then the other thing, which is new out in the medical world, is brown fat. So brown fat is highly packed with mitochondria. When you look at it under a microscope, it actually looks brown. And brown fat is the type of fat that we have that generates heat. And in order to activate our brown fat, we need to be cold. And how many people nowadays ever get really cold? Because we always like that thermostat right at 70 degrees.
Yeah.
It goes to 70.
I go in the ice bath every day.
Yeah. So right. So if the temperature goes to 71, we turn on the air conditioning. Goes below, we turn on the heat. Right. We give them this thermonuclear zone, and we never actually activate our brown fat. And activating our brown fat by being in the cold. In fact, this past weekend I was at a mega institute. And I actually camped out, and it's a long story, but I brought my tent, and my tent didn't have the poles to it, so I had to sleep on the ground in my sleeping bag. And fortunately, the sleeping bag was a warm sleeping bag, but I got cold at night. But guess what? I slept great.
Yeah,
I slept great.
It's true. The best sleep I've had in years was when I went backcountry skiing with my daughter last spring, and we literally climbed 6 hours straight up to this yurt, which was literally 6 feet under the snow. We had to dig it out, and I slept in my sleeping bag there. It was freezing. And I slept the best I slept ever.
Yeah, you're like in a semi-hibernation.
Yeah, I actually bought something called a chili pad.
Yeah,
which is essentially a cooling pad that you put on your mattress. So I can turn it down to like 63 degrees at night because my wife likes it hot and I like it cold.
I think she did a little podcast about that.
She did. My wife's a comedian, and you can look her up at MyMiaLux on Instagram, and you can watch that funny spoof on how she has to wear a winter coat to bed with me, which is not quite true, but yes.
Yeah. So mitochondria, and how do we test for mitochondria? When you go to most doctors don't even remember mitochondria in their training, nor do they ever test for it. So we test for organic acids for it. You can also
it's a urine test. It's easy to do.
Yeah, relatively easy to do, and you can also do genetic testing for mitochondria. There are some labs out there. Cortigen was one of the labs that we used to use, but they're no longer around. There's another one called Gene Savvy that does testing for mitochondria. And when you get an inherited mitochondrial issue, that's where, maybe seeing
That's
somebody
more
who's
serious.
Yeah, that's much more serious. But you can also have a lot of acquired mitochondrial issues. And the good news is that we can heal our mitochondria when we actually go through periods
Well, before you get to what heal, what messes them up?
what messes them up.
Yeah, what messes them up?
Well, excessive oxidative stress will do it. So
That's free
infections,
radicals.
yeah. So excess amounts of free radicals, oxidative stress, because your mitochondria is like a fireplace, and you throw logs into your fireplace, which is food, and you give off sparks. And you throw too much food, logs in the fireplace, you get too much sparks, and you get too much free radicals.
Too many calories.
Too many
bad calories.
Too many bad calories,
like
exactly.
sugar and starch.
And too many bad calories not compensated by enough dietary antioxidants is another potential source. Antibiotics are huge,
Yeah.
especially the floxins. I mean, that's a whole topic unto itself, as being floxed, which I'm sure you've seen patients with that, because they definitely are bactericidal antibiotics are definitely poisonous to mitochondria, and statin medications. The ones that
The muscle aching that people get is because their mitochondria are getting injured.
Right, so the cardiologist handed out like Pez candy, right, Mark?
Yeah.
It should be in the it should be in the water, right? We should just
They wanted to sell it at McDonald's.
yeah, right. Just
Have one with your Big Mac.
yeah, exactly. Yeah, it's
No, but they are, and they do cause muscle damage, and some people are more susceptible to it.
Absolutely.
And there's genetic, I think, variations in how people respond to statins, and that's probably has to do with their mitochondrial function.
Right.
But it's for sure. So toxins also, like heavy metals and pesticides, are poisonous. Too much sugar and starch and calories. Oxidative stress that comes from inflammation. I mean, that's why when you have the viral flu, you feel achy and tired and sore because your mitochondria are getting nuked.
Yep.
Right? Nutritional deficiencies, right? We need all sorts of nutrients like carnitine, CoQ10, B vitamins, all play a big role in the mitochondrial function. So,
and phosphatidylcholine for the membranes of the mitochondria. The other thing that's also really important, and as you're well aware of that, is the concept of doing fasting periodically. And I find this actually quite fascinating because a lot of religions have fasting as part of their religious belief system. And when you actually look at that, giving your gut a time period of rest, and when you go through these periods of fasting, your body starts eating up the bad mitochondria. That's autophagy. We call that the body's eating itself. So
like the garbage truck cleaning up all the waste from your cells, which helps you renew and repair and regenerate, and actually get younger.
And intermittent fasting can do amazing things for the body.
And what is that? That's like when you eat between a 8-hour window?
Yeah, there's multiple ways to do that. You can eat 16 hours without food, eat during an 8-hour window, or maybe on the weekends just have water or a juice fast or something like that. There's different ways of doing that. But when you cut back on your calories dramatically and you do that for an extended period of time, your body goes into what's called ketosis, as you well know, and then your body also starts to generate increased antioxidant enzyme systems, and that also starts to clean up and sweep the house, gets rid of all the bad cells.
Snacking and eating all the way till bed and waking up and having breakfast, that's the worst thing.
No, exactly.
Well, it's great
unless you're like a teenager and you're like your metabolism has gone wild and you need to be fed all the time because you're just growing all the time. But 3 meals a day with snacks is probably not the best thing for you.
That's an important thing because a lot of people have mitochondrial issues, and I personally had severe mitochondrial issues because I got chronic fatigue syndrome from mercury, and my muscle enzymes went way up, and I had severe muscle aches and fatigue. And it was really working on my mitochondria by getting rid of the metals and fixing my gut and giving myself a lot of mitochondrial nutrients that really helped me recover from that. Yeah.
Yeah, and they're actually working on some of the nutrients, like the nutrients that increase the NAD plus in the body, or even intravenous NAD, which is another it's for IV therapies that's been shown to be quite helpful for
brain issues,
absolutely,
and trauma of the brain, and cognitive disorders.
Yep. Yeah. Very, very powerful. And actually, even for people who are floxed, that's actually one of the treatments.
Yeah. So what you're talking about is providing a lot of the nutrients. So 1, you have to stop doing all the bad things that cause to be a problem. And 2, you have to provide the basic support to help them work better.
Yeah.
Right. So whether it's intermittent fasting or calorie restriction for periods of time or days of fasting, whether it's these nutrients like NAD, which you can now take orally, CoQ10, And these are the kinds of things we look at in functional medicine. And at the UltraWellness Center, we can test for these things. We can see what's not working. And unless you look, you don't know what's going on. And that's really the beauty of this approach, because we might not see, quote, a disease, but we might see a dysfunction. And I've had patients with Parkinson's disease I have one now who I've had 10 years of Parkinson's, and he's doing amazing and hasn't progressed. In fact, got better from where he was by working on all these things.
Yeah, Parkinson's is tough. It depends where you catch them. But the big thing is to try to arrest the progression and try to reverse it if you can.
Yeah, and
Absolutely.
A lot of it is a mitochondrial disease. We know well that CoQ10 and other things help with Parkinson's, and it's actually a mitochondrial problem, like many diseases.
Well, also, the interesting thing is that they're also finding a direct connection with the gut microbiome in Parkinson's. Because interestingly, there's some patients, Dr. Barity, he had some patients who had C. difficile colitis. The patient also had Parkinson's. They got a stool transplant for their C. diff colitis. Guess what? The Parkinson's got better.
Yes,
hey, wow.
Yes. Actually, I remember reading a study that people who had constipation have a 300% increased risk of
constipation is not benign. Exactly.
Yeah.
Yes.
I mean, I had a guy today who was like, how often do you go? Like every 3 or 4 days. I'm like, that's not normal. He says, normal for me. I go every 3 or 4 days. I'm like, no, you should go twice a day. He's like, twice a day? What are you smoking? Like, I think that is not what people really think of as normal, but it really is.
Right.
And I think it connects the dots, the gut, the immune system, the mitochondria. It's all one system. Everything is connected to everything else. It's sort of like, the knee bone's connected to the thigh bone and all that, but it's actually true in the body.
Yeah.
And we treat people in all these silos with all these specialties.
Yes.
And unfortunately, it doesn't help them get to the issues that can really help them get better.
Yeah, and I think the other thing that's also, I think, really important, and I've learned this the more experience I get, is I always go into each patient with what I call a Zen mind, very open-minded. I don't really, I just sort of listen, and I don't have any preconceived notions of what's going on. And if I just listen to them, make notes, and try to then connect the dots, and that way there's no preconceived. Well, I think you have this, or I think you have that. You can even do that in functional medicine. Like, I think you have leaky gut, or I think you have gluten. Well, guess what? There is no leaky gut. There is no gluten. Well, got to look somewhere else. Maybe you've had a tick bite. Maybe you have pesticide poisoning exposure. Maybe you're glyphosate toxic. I mean, there's all different pathways that you can go down, and it does require playing detective.
Yeah, I remember I had a patient who grew up in the Bronx and was very poor, and she lived in an apartment complex where cockroaches
And they get spray 'em. Yeah.
were crawling all over her, and she hated pests. So she moved to the suburbs, and she would have the exterminator come every month to spray inside and outside her house. And she had an entire barrel, like a 50-gallon barrel of chlordane, which is now banned in this country, and was exposed to this over and over and over. And she got Parkinson's at 50 years old.
Yeah.
And we helped her by detoxifying her, by working on her mitochondria and doing all those things we talked about.
Well, it's interesting you say that, because I distinctly remember reading an article that was looking at Japanese men, and they had a higher incidence of Parkinson's as they ate more fruits and vegetables. So the logical conclusion is eat fruits and vegetables, get Parkinson's. Wrong.
Because of pesticides.
Exactly. Pesticide-laden fruits and vegetables.
Yeah. I mean, farmers are one of the worst. The farm workers are one of the worst exposed to pesticides and the highest rates of Parkinson's.
And then I'm even talking about the herbicide Roundup, with the glyphosate and the effects on the gut microbiome. That's another big one. That to me is probably one of the big elephants in the room in modern day society.
Yeah, glyphosate. I mean, we actually test for glyphosate, and I was like, I'm going to test it. I don't probably have any because I eat organic and I don't avoid pesticides, and I'm really careful what I eat. But the truth is, I travel half the time, so I don't always have control.
No, right, exactly.
And I checked my urine. I was like, holy crap, I'm probably in the 50th percentile for glyphosate. I thought I'd be in like the 10th percentile.
Yeah.
And I'm like, this is not good.
Yes, exactly. And the other thing that it's been touted is that, that glyphosate is safe because it doesn't affect any of the biochemical pathways in the body. Well, lo and behold, it actually affects the chitinase pathway, which is actually how the bacteria have their metabolism. So when you're using glyphosate, you're actually messing up the metabolic pathways of bacteria, especially gut bacteria.
Yeah, it also affects glutathione and other things. There's transgenerational effects.
Yeah.
So that's one of the things we do here as well. We deal with a lot with understanding how toxins affect the body, how to help the body detoxify, and doing it in a way which actually creates profound results.
Yeah. Yeah.
You know, what are the biggest things you think about when you think about toxins, and how do we sort of look at those in our practice, and what do we do and see?
Well, it's, I actually have given talks on toxins with God rest his soul, Walter Crinian. He was a big.
He died?
Yes, he died. Yeah, he died. Yeah, and there was we used to talk together about this seminal article. I believe it was in Science. It was called the exposome, which is the sum total of all the different toxins that we get exposed to.
Or everything. It's our diet, stress, your microbiome. All those are.
Exactly. And to some degree, there is a little bit of survival of the fittest. So the people who can detoxify well will actually survive in modern society better. When you're sort of like the cockroaches that are resistant to DDT. I mean, that's
not me. I'm susceptible.
So the toxins that we're exposed to are probably one of the biggest sources is pharmaceutical industry. I consider pharmaceuticals as toxins. Yes, they're toxins, but just like if you know what to give at the right, poison at the right dose at the right thing,
the dose makes the poison.
Dose makes the poison, exactly. And what the big dirty secret is that these chemicals, get peed out and pooped out, and they go into the water systems, and no water systems are actually checking for some of these chemicals, hormones, antibiotics, pharmaceuticals. And
there's been studies on this. They find these in there.
Totally. And I believe, without question, that the pharmaceuticals, which are everywhere, when you look, people are, taking, handfuls of different pharmaceuticals, these are getting into the water system. And I believe they're actually probably affecting us in some way. So having clean water, clean food are some of the ways that which we can, help with our exposure to toxins.
Yeah. I mean, the Environmental Working Group.
Clean air. Yeah, exactly. The Environmental Working Group is a good resource.
A great resource. They have all this of how to avoid toxins in your seafood, in your meat, in your vegetables, in your household cleaning products, in your personal care products.
Yep.
It's a great resource, ewg.org.
Yep. Yeah, EWG, exactly. Yeah. And just, being aware of it is important. And, I talked earlier jokingly about red wine. Well, the dirty secret about, California and all the wines in the United States is they're filled with pesticides, fungicides, and glyphosate.
And arsenic.
Yeah. So if you're going to have wine, you want to make sure it's organic or from Europe, because they don't allow to the same degree that we have in the States.
I saw this guy had a wine filter the other day, like a water filter. I was like, wow, that's interesting.
I don't know if it'll actually filter all that stuff.
I don't know. I'm going to try it.
but again, they've shown that, Cheerios and all these food products, have glyphosate in them.
Yeah.
Even some of the things that are quote unquote organic, you can find glyphosate in them. So
yeah, I just read that the Impossible Burger, which is this plant-based, healthy, quote, soy burger, which is GMO soy, has 11 times the glyphosate levels of the Beyond Meat, which is made from pea protein, because soybeans are sprayed with glyphosate.
Wow.
That's striking.
Yeah.
Wow. And so you're trying to do something healthy, and then you're ending up poisoning yourself with glyphosate by eating a soy burger.
Right. Yeah. And I think that, people are trying to be healthy, but sometimes they're making the wrong choice. They're sort of, like I had this one guy who thought, being a vegetarian is good and eating soy is good. So the guy was eating soy burgers, tofu burgers, and all the soy stuff. The guy literally grew breasts. He was starting to have gynecomastia from all the estrogen effect of the.
It's mostly the processed soy.
Yeah,
because the whole soy, traditionally, if you're eating it in reasonable amounts, won't do that.
Right.
But yeah.
There was all the process, exactly. Yeah. Highly processed, exactly.
Which we think is quote a health food, like a tofu, a turkey soy thing, or a turkey or soy bacon or a soy burger.
They're all frankenfoods.
Yeah,
they're frankenfoods.
It's still highly processed, and it's not a whole food plant-based diet.
Exactly.
Yeah. So just talking about the mitochondria, going back to it for a minute, I was just remembering a patient I had who had heart failure. Now, we think of heart failure as this one-way street. You get it gets worse, you try to manage it with a lot of medication, but it turns out that it's a mitochondrial problem, and you can actually treat it with mitochondrial nutrients. And I recently had a guy who was a healthy-ish 70-year-old guy who developed heart failure, and he had a number of things going on with him that we treated that were underlying inflammation, but I gave him a bunch of support for his mitochondria, ribose and carnitine and CoQ10 and magnesium and a bunch of stuff. And his ejection fraction, which is the strength of which you can pump blood out of your heart, went from like 30%, which is a few steps away from a heart failure, to over 50%, which is pretty much normal,
Yeah.
which is pretty amazing when you see that. And it's, again, not something traditional cardiologists will look, oh, let me see your mitochondria. Like they don't know how to think about it or test it or look at it.
Yeah, exactly. Yeah, yeah, and obviously, your heart doesn't rest, right? Even when you're sleeping, your heart's pumping.
Yeah, I hope so.
So mitochondria is really important for the heart, and absolutely, there are cases of patients having improvements of heart failure and reversal of heart failure with a mitochondrial nutrient support.
I have many of those cases.
Yeah.
It's pretty amazing. So one of the things that we do also here at the Ultra Wellness Center is intravenous nutrition. Can you talk about why that's important, what it does, and who it's good for?
Well, sure. I mean, there's intravenous nutrition is a catch-all term for giving nutrients through the veins and sort of bypassing the gut for absorption. And there are some patients that, for whatever reason, they may not be absorbing their nutrients as well. So some of the things that we use here would include things like the Myers cocktail. We might also use.
And what's in that?
B vitamins, magnesium, and B vitamins are very, very, Bruce Ames is the one who brought my attention to the B vitamins, because a lot of people have subclinical genetic deficiencies where they need higher levels of B vitamins. So giving B vitamins actually supports mitochondrial function.
Yeah.
So when you give these B vitamins and magnesium, you can boost the effect of mitochondria through the augmented effects. And then glutathione intravenously is also a fantastic tool. IV vitamin C, we use that for a host of different things. And
When you mentioned the IV NAD.
yeah, IV NAD, yeah, that I think is actually, that's really amazing stuff. It's really, really cool. So there are patients who do need, I don't want to say that everybody who walks through the door needs an IV, but if you want to support, and people who are sicker, people who have more unexplained fatigue, you can definitely do that. There was a study with IV vitamin C and sepsis.
Infection.
So this is a really interesting thing. So IV vitamin C, we use it here for patients who have potential cancer, chronic infections, Epstein-Barr virus, et cetera, flu
Immune
or whatever.
issues, yeah.
And so at high levels, vitamin C is actually a pro-oxidant. It's not actually an antioxidant, it's actually a pro-oxidant. And the interesting thing is that there are some studies out now that if you go into a hospital and you have septic shock, your mortality, which is normally about 40% of people who die in the hospital, if you give them IV vitamin C along with, I think, steroids and a little bit of thiamine, the mortality went from 40% to 9%.
Wow.
So it's a 4-fold decrease in death.
That's unbelievable.
Yeah.
And
4 times.
there's no drug that can do that.
Exactly. Yeah. Yeah. So you go from like 10% to, or 40% down to about less than 10% mortality. Pretty amazing.
It is pretty amazing.
Powerful stuff. And it's cheap.
Yeah, it's very cheap.
Yeah. So you're not going
to
to see a lot of research with that with big pharma, because they're not going to make money on it.
It's true. It's there's a gap in research. A lot of things we do know work clinically. We've all had experience with for decades. Doesn't get the funding because the NIH isn't funding it, and neither is drug companies. So we're kind of stuck having to look at smaller studies or small groups of people are studying this. So we're doing all these things we talked about here at the Ultra Wellness Center. It's a really unique practice. We have, 4 physicians, 2 physicians assistants, 4 nutritionists, a whole bunch of nurses, and we're taking care of people in a team approach where people come in, they get this full evaluation. We're the medical detectives. We find problems that most people have struggled to solve for decades, and often very quickly we know what to do, and we support them over time with coaching and with encouragement and follow-up visits. And it's really a pretty unique center here at the Ultra Wellness Center, and collectively, we've had probably 60 years of collective experience in practicing functional medicine, which is, I think, pretty unique in the world. We're getting older, but we're just getting smarter. And, we've all personally had challenges with our health, and we've used this model to really help recover. And I remember when I was really sick, you and Dr. Bohm came over to my house and helped me think through what was going on, because my brain wasn't working, because my gut wasn't working. Exactly. And it's just so rewarding to see these patients. You had a recent case that you wanted to share about Alzheimer's, right?
Yeah, it was a fantastic case. It was a patient who I saw who came down from up north in Canada and was given a diagnosis up there of having Alzheimer's, and was pretty much sold,
Get your affairs in order.
Get your affairs in order, exactly. And there's not much we can do for you. So he came
Yeah,
down.
the treatment for Alzheimer's is a lawyer.
It's a lawyer, right, and a rabbi or priest, right?
Yeah.
So the patient came down, and I saw her with her husband and did a complete workup. And as you know, through some of the writings of Dale Bredesen and also a functional medicine approach, is that
And this book
Alzheimer's
called the Ultra Mind Solution was really good.
Ultramind, yeah. But that wasn't about Alzheimer's though.
No, but it was.
Oh, well,
a lot of Alzheimer's cases was about the brain.
Yeah, right, yeah. So and I love the analogy.
I wrote that, by the way.
Yeah, the analogy of Alzheimer's is like a roof with 32 holes in it, and you're not going to fix it by just doing one hole. So I did a full workup on the patient, and the other thing which most doctors and even dentists aren't aware is the role of the oral bacteria.
Yeah.
There's actually some really interesting studies that when you have bad bacteria in your mouth, specifically
gum disease,
gingivitis, periodontal disease, Porphyromonas gingivalis, it highly causes systemic inflammation, which in turn affects the brain and causes brain inflammation and brain deterioration over time. So her workup included checking for heavy metals, checking for herpes viruses, because herpes simplex is also associated with that, checking for the ApoE4 genotype.
Which predisposes you but doesn't predestine you to Alzheimer's.
Exactly. Just because you have it doesn't mean you're going to get it, but you're one of those people who has a more robust immune response, so you have more inflammation, which is great on a short term, but on a long-term basis, you don't want chronic inflammation. So she had a whole bunch of things. She had some mercury, she had some oral bacteria, she had some gut bacteria, she had some gluten issues, she had herpes simplex, she had the ApoE4 genotype. So I sort of worked on all of those things. We also changed her diet. And within a matter of months, her husband said, I have my wife back.
Wow.
Yeah, she was now able to converse, to talk. She can drive by herself now.
So you literally stopped and reversed the effects of Alzheimer's.
Right, exactly. Yeah, it was pretty amazing.
And what do you think it was of all those things that you did? Or was it all the holes?
It was all the holes, exactly. It was, and we we talk about root cause. It's actually root causes. So I think there's sometimes there's one big one, but then there's all these other things that are supporting that also play a role. So I just addressed all of them in like a checklist fashion.
It's interesting you say that because traditional medicine is there's sort of the joke about neurology is diagnose and adios. Here's what you got, nothing to do. I'll see you later. And I think it's certainly the approach now with Alzheimer's because we've spent billions of dollars on hundreds and hundreds of studies with nothing to show for it. It's because we've been looking down the wrong path.
Right, because we've been looking at amyloid plaques, which are a hallmark of actual inflammation/infection in the brain. Just like cholesterol doesn't cause heart disease. Cholesterol does not cause heart disease. Inflammation causes heart disease. Cholesterol is a bystander.
Yes.
Trying to repair that inflammatory process.
Like the body's Band-Aid.
Right. So beta amyloid in the brain is actually an antimicrobial peptide. It tells you that the body is trying to fight off some type of infection, be it a spirochete from Lyme disease, syphilis, a virus, or a fungi.
Yeah.
So that's, beta amyloid, we've been, saying, well, if we get rid of the beta amyloid, find a drug to remove the beta amyloid.
It's the wrong thinking is the problem. And in functional medicine here at the UltraWellness Center, we do a different kind of thinking, which is what are all the treatable things that we can find that could help this patient's health get better in general? And that also helps the brain get better. So it's not to say that we can come in here and cure all cases of Alzheimer's. That's not true. But we can certainly, especially if you're far advanced, but we can certainly, if we get it early enough, we can help to slow it down and maybe even reverse some of the effects by using this approach. And
absolutely.
Not only have you found this, I found this, and dozens and dozens of other doctors doing this approach across the country have done this, and yet it's still in the outside of healthcare.
Well, what's also really interesting is I'm seeing more and more doctors and nurses who are in mainstream medicine coming to see me and they're in like some of the best hospitals, best centers because they can't get help in their system.
Oh, for sure. It's true. A lot of our patients are healthcare professionals.
Exactly. Yeah, and I think when a physician has either themselves or a close family member or spouse or whatever get a condition and you're butting your head against the wall with the mainstream approach, that's where you start, you sort of fall into functional medicine because this stuff's not working. I gotta put more tools in my tool bag.
Yeah. Well, that's the thing here at the UltraWellness Center. We have a lot of tools. We have a different way of thinking. We work as a team, and we've been doing it for a long time. So if you're listening and you've suffered with some chronic thing that hasn't gotten better, or you have any one of those diseases or conditions we talked about, or pretty much anything,
Yeah.
we can really make a difference in helping people find the root cause, be medical detectives, and help people create a pathway that gets them back to health. And that's really the goal here.
Yeah, and the other thing is, so many practices have what I call protocols. And the protocols are sort of like you do the same thing over and over for everyone. And we don't really have protocols here. We have certain things that we do use in a lot of
We have an
patients.
approach.
We have an approach, but we don't have a rubber stamp. You're not going to come in at the UltraWellness Center and everybody gets the same treatment. That doesn't work.
Right.
Nada.
Exactly, because it's different for everybody.
Right. It's ours is very much personalized and proactive and a deep dive into nutritional, biochemical, genetic, toxic biology.
Yeah, and as you mentioned with that case with MS, that's one case with MS. Another case might be very different.
Exactly.
And I think what you saw, that patient with Alzheimer's, someone else with Alzheimer's might need a very different approach.
Exactly.
So that's really the beauty of functional medicine. And you are one of the pioneers. You are a leader, and it's so great to have you here at the UltraWellness Center, Todd. Thank you for joining us on the Doctor's Pharmacy.
All right. Thanks, Mark. Enjoyed it.
So if you've heard anything that piqued your interest, or you know anybody who's suffering or you're suffering, you can find out more about our center at the ultrawellnesscenter.com. That's just ultrawellnesscenter.com. And if you love this podcast, we'd love to hear from you again. Leave a comment, share it with your friends and family on social media, and subscribe wherever you get your podcasts. And we'll see you next week on the Doctor's Pharmacy.
Thank you, Mark.
Hi, everyone. It's Dr. Mark Hyman. So 2 quick things. Number 1, thanks so much for listening to this week's podcast. It really means a lot to me. If you love the podcast, I'd really appreciate you sharing with your friends and family. Second, I want to tell you about a brand new newsletter I started called Mark's Picks. Every week, I'm going to send out a list of a few things that I've been using to take my own health to the next level. This could be books, podcasts, research that I found, supplement recommendations, recipes, or even gadgets. I use a few of those. And if you'd like to get access to this free weekly list, all you have to do is visit drhyman.com/picks. That's drhyman.com/picks. I'll only email you once a week, I promise, and I'll never send you anything else besides my own recommendations. So just go to drhyman.com/picks, that's PICKS, to sign up free today.